Hey, welcome to another episode of Your Faith and Health Community. I'm your host, Pastor Jackie Jackson, and as always, on behalf of myself and our producer, Anita Alexander, we want to thank you for taking out time from your busy day to spend with us. Prayerfully, we'll share some information with you that will be life-changing, that will be quality of life enhancing, that will just make your day. But before I start, you know I've got to ask the question about health care. Have you gotten enrolled in health care? Do you have health insurance? Listen, there is an epidemic that's quickly becoming a pandemic, and it may have already, and that's the coronavirus. That is going around. At first, it was just worried about it because it was overseas. Then they were concerned about people bringing it. But if I remember correctly, today I read that someone in California has contracted it, and they haven't been overseas, nor have they been in contact with anyone. They've gotten it. How? No one knows. So that means that you and I are at risk. So you need to have health care. If you haven't gotten enrolled, you know you can go to Medicaid. If your income is $16,228 or less and you're single, that makes you eligible to enroll in Medicaid. That covers your dental, vision, doctor's visits, emergency room, hospital stays, prescriptions. It covers all of that. You need it. Now, if you're single and your income is above that, then you want to go to the marketplace. Now, open enrollment for the marketplace is closed. I need to go back and say enrollment for Medicaid is year-round. It doesn't close. But for the marketplace, it's closed unless you've had a life-changing event. You recently got married or divorced, had a baby, changed jobs, just moved into the state that you're in this case, Ohio, or if you're coming home from a correctional institution. That's called a life-changing event, and you have 60 days from your life-changing event to be able to go into the marketplace and enroll for health care. Also, just to let you know, for Medicaid, if you're a family of 4, and you have a combined income of $44,500, that makes your whole family eligible for Medicaid. Coronavirus is serious, just as everything else, heart condition, high blood pressure, diabetes, you need to be covered. Listen, medical bills are one of the leading causes for people having to file for bankruptcy. So I'm not going to harp on that. You hear me do it every time. Hopefully you've done it. If you have, give yourself an applause. If you haven't, get your behind somewhere and get you some health care. So I'm done with the health care for now. Till next time. We have awesome guests with us today, and I'm really looking forward to having a conversation. We have with us Marchelle Williams Evans, and she is a RN, BSN, and I'm going to let her tell you what all those initials go for. I know them, but I'm just going to give her the opportunity to do it. She is the owner of Opening Doors Independent Disability Service Consultants. So in case you haven't gotten it, she's a nurse, and her passion is helping people, but especially people with disabilities. I want to thank you for being on the show today.
Thank you.
And so you are, well, before we go, explain all those letters behind your name.
Registered nurse with a bachelor's degree in the science of nursing.
So she's letting you know right off. She's not just somebody from across the street. She knows what she's doing, and she's going to give us some information, especially if you have a loved one that you're caring for that has a disability and need to get some information and someone that can help you walk through this, right? So you're the person that we need to speak to. So Opening Doors Independent Disability Service Consultants, what is that?
That is a service that I provide for individuals in the community that have disabilities. I help family members secure services that they otherwise would not get without my help. I work with people from the ages of, from birth to 62. And what I tend to do is I follow my daughter's age. Whatever age she is, that's the population I tend to deal with, but I can go back as far as birth. So what I do is I identify the need of families. They call me, they find me somehow, I don't know how. I don't pass out cards. Generally I don't, sometimes I do. If I see someone that really needs me. I meet people through a word of mouth. And when they call me, they have already exhausted all their resources. Everyone has told them no to anything that they need. I can assist in getting nursing care, one-on-one care, caregivers with like trained certified nursing assistants or state tested nursing assistants, or even homemakers, to work with people that otherwise couldn't do it themselves. You have mothers out here in the workforce that don't have anyone to keep their children, so they can't go to work. I was faced with that. I was blessed to have a lady come to us 22 years ago that has worked with my daughter all that time. And she has not wavered at all, but I found her service through my daughter's illness. My daughter has multiple disabilities. Can I tell you about them?
Please.
Okay, she has something called hydrocephalus, which is increased interventricular pressure on her brain, where the the spinal fluid doesn't flow correctly through the brain, so they had to place what's called a shunt in her head. And they did that when she was 4 days old, and they have revised it, which they have to take it out when they grow. They have revised it 10 times. She's had epilepsy, she's blind, and she has selective mutism, which means she talks probably twice a week. She is capable of talking, but she doesn't anymore.
Okay.
Okay. When she got sick in 1998, I had a lady come to me and say, if you can't work because you need help for your daughter, let me help you get help for your daughter. And that's how I got started in this whole thing. I actually got started a lot sooner than that, but I didn't get care for her until she was 12 years old.
Since we're talking about her, who is she? What's her name?
Her name is Christina.
Christina.
And Christina's 33 years old. She was...
She's my age.
Okay. She was a premature undiagnosed twin. And she was diagnosed, the twins were diagnosed 30 seconds after she was born. We didn't know I was having twins until 30 seconds later. And
surprise.
Yeah, really. And they both were born with brain bleeds. And the brain can bleed up to grade 4. And hers bled grade 4 on the right and grade 3 on the left, which the opposite side of your brain affects the opposite side of your body. So if you have a bleed on the left, it affects the right side of your body, and vice versa. And my son had grade 4 on both sides. Well,
let me ask you this before you go on, and especially for someone who may be, individuals who may be experiencing this for the first time. And you know how sometimes you're hearing words, and when doctors are speaking, they're throwing words out and not always explaining. And for me, when you say a grade 4 or a grade 3, what does that mean?
A grade 4 is the level, and it goes from grade 1 to grade 4. And grade 4 is the greatest level. So that means he had a massive bleed on both sides of his brain. She had a massive bleed on one side of her brain and not so massive on the other side. He, as a result of his bleed and his heart condition and his premature lungs, he passed away shortly thereafter.
I'm sorry for your loss.
Thank you. And I just prayed for a miracle that I would be able to at least keep my daughter. You know, I didn't care if something was wrong with her. I just wanted to have her. You know, I just wanted God to give her to me. And, you know, I promised him if he did, I'd give them all back to him. And he gave it to me, and she is an awesome individual. She got a kind spirit. Like I said, she don't talk, but she don't complain. She's really bossy, though. She doesn't talk, but she's very bossy. She is the reason I do everything that I do. If it were not for her, I wouldn't know about any of the things that I help people do. In 1986 is when she was born. I met a lady who had 3 children with disabilities. Christina was in the hospital for 119 days. And I told the lady about my daughter, and she said, well, let me help you. And she just did, and she told me everything that I needed to do.
Now, was she a nurse? Was
Nope.
she from Hamilton County? Was it Hamilton County learning disabilities?
Nope, she was from El Paso County, Colorado. That's where my daughter was born.
Okay.
Colorado Springs. And we were having a conversation, waiting on our free Christmas toys for our kids. And she I told her about my daughter. She said, well, I have 3 children with disabilities. She had one with hemophilia, which is a bleeder. And then she had one with cancer. And then she had another one that had already been diagnosed with HIV, because he was a hemophiliac too, and he had received a blood transfusion early in life. Well, anyway, she told me what to do. Never met this woman, never saw her again. She told me everything to do. And I mean, it was so amazing because all the time she was in the hospital, nobody told me anything. Nobody helped me do anything. So when they discharged her after 119 days, they said, here, this is your daughter. Take her home, raise her with the rest of your kids. Not that she gonna need 10 brain surgeries. Not that she gonna be blind. Not that she gonna have continuous ongoing problems for the rest of her life. Take her home and raise them. We're not gonna give you any resources, and they didn't. And so before the day of Google, I had to figure all of this out. Okay.
Yeah, and that's more. I don't think people realize now, because we've gotten so spoiled, to Google it. Just Google it. I mean, anything. To remembering, for those of us that were around, how difficult obtaining information was.
That's true.
You know, it wasn't just a few keystrokes and you've got all that information. So I applaud you for that work. Let me ask you, how long, and you may have mentioned it earlier, but I don't remember. So how long have you been in nursing?
27 years.
27 years. That's a long time. So going into nursing, was that a result of your children? Is that what pushed you along those lines?
Yeah, yes. You want to know the truth? I'll tell you. Okay, I had 4 children and a husband that said, I don't want to do this no more. Y'all too sick. I'm leaving. And he did. So when he left, I had to work in medical records. I worked in medical records in a hospital with 11 floors. And I hustled shifts from that 11th floor all the way down to that basement. I worked 72 hours a week. And I couldn't see my kids. And so my friend came to me and said, I give you a year to get your life together. I'll help you with your kids. And so I went and took the little 48-week LPN program. And after that, I was able to pay my mortgage, you know, pay my bills with 1 or 2 paychecks. I didn't have to struggle as hard.
Right.
So I did that. And that was good, you know. But, you know, the bigger reason was I needed to be able to make intelligent decisions about my daughter's health. And then I had a son later that was born and diagnosed with a disability. So, but he was actually born before his father left. That's why, you know, he was just like, I'm out of here. So I'm okay. So I figured that part out, and then I moved to Cincinnati after that to be with family because I didn't have a support
So you're not
system.
from here?
I am originally from here. I was
Okay.
born and raised here. Yeah, I moved away. I went to the Army in 1981. I'm a veteran. I did 9 years in the United States Army, and when Christina was diagnosed as deaf blind, I got out.
Well, first let me say thank you for your service.
Thank you.
Where'd you do basic?
Fort McClellan, Alabama.
Alabama. Okay. Where'd you do your AIT?
My AIT in Fort Sam Houston, Texas.
Fort Sam. Oh, all right. Wait, what was your MOS?
A 71 Golf and a 91 Alpha. 71 Golf is a patient administration specialist, and a 91 Alpha is a basic field medic.
Well, I mean, you were at Fort Sam, so I guess that doesn't necessarily transfer for people to know.
I was in a MASH unit.
But you were at Fort Sam. I know what you were doing. I just wanted people for you to let people know what you were doing there. What drives? Because I understand your drive for your daughter, and that makes sense for your children. Everyone's drive for their children doesn't always transfer to drive for everyone else. But in your case, it seems that what God did was what somebody else might deem something bad. God said, no, it's not. This is my child. I'm going to put on loan to you because I trust you're going to do what needs to be done. And in the process of that, I'm going to bless you with some things far beyond what you may have thought about. And so I'm just throwing my 2 cents in, believing that's what he did. But your passion to start your organization, your company, that also helps other people? Is it a pay it forward from this woman who may have been an angel, since you said you saw her then, she, no more, right?
Right.
But is that where your passion to help other people come from, or what drives it?
It is. I help people because somebody had to help me. And people just don't know. Cincinnati, Hamilton County is the most underserved county that I have ever seen. And I've been a lot of places. I've lived in 9 states, so you know I've been a lot of places. And people just aren't getting services. I know parents that have children that are 25 years old, never had a caregiver, never got free diapers, never got free formula, you know, and they qualify for all this stuff because once your child turns 18, they're their own person. Your income no longer matters, okay? So I help people because it's always been in my nature, to help people. But to help people get things that they really need is even more so in my nature.
So, but all of this stems, and it makes sense from knowing and understanding. You've been through it, so you know what it's like to be a mother or to be a parent with a child with a disability and not have any help.
Right.
Like you said, at the hospital, up and down, from floor to floor, 72 hours away from your children, period, is rough. Then when you have a child with disabilities and hoping that whoever or wherever they are, they're being taken care of. And who gives more love to your children than you can give?
Right.
So that part is really great. And I want to thank you on behalf of everyone that you're helping, that you've helped, that you're helping, and the ones you have not even come into contact with. I want to thank you on behalf of them.
Okay.
So in talking about the Opening Doors Independent Disability Consultant, Service Consulting, which is your company, what services do you help people with? What do you help them do if I come there?
If you come, it depends on your need. We do an assessment and we figure out what you need. You tell me what you need. You say, I got a daughter, I got to go to work, I ain't got nobody watch her. I said, well, are you getting, do you have a waiver? Do you have a support administrator? They tell me no. I get them enrolled. I help them go through intake through the Department of Developmental Disability Services, and then they get on a waiting list. It depends on what your need is. Sometimes I've seen people, in fact, one of my success stories is I've seen a man go from number 1,500 to number 7 in less than an hour because I was there.
You mean on a list, on a waiting list?
On a waiting list.
From 1,500
to number 7.
To number 7.
Yes. That's amazing.
Oh, yeah, that's I think everyone should be dialing your number. But, you know, and since you put that, let me ask you then, because I can't say I personally know what it's like to be on a list waiting for help of that nature with my children. But for someone it is, and they should reach out to you, what is it about your company, your organization, that puts you maybe above, or we're not going to go into competition, but what separates you from some of the other organizations that make the work that you do, that you could get someone from 1,500 to 7? Oh, of course I want the truth.
Okay, because I got a really big mouth and I'm not afraid to speak up. That's number one. Number two, I know the rules, and if you know the rules to the game, you can play. If you don't know, they'll shut you up, sit you down, and then you don't have anywhere else to go. You know, I'm in this fight right now with a client who has a special request, and I don't think anybody should be eliminated because they have a special request. I think that if you have a special request, your need doesn't change. You can't take away those services because your need doesn't change. You continue those same services. I'm willing to fight. Are the parents willing to fight? I don't know.
Well, Jesus said you have not
because you ask not.
So
I'm asking for everything.
Hey, listen, may as well ask for. Well, I say shoot for the stars, land on the moon.
Exactly.
You know, or shoot for the moon, and whichever one it is, shoot for the highest one. And then if you don't hit that goal, at least you still shot high.
Exactly.
So that part is good. Do you do seminars or workshops?
I do.
So tell us about some of these seminars.
Listen, I do a seminar once a year, sometimes twice a year, just depends where I can find interest. If I call a group, I have a group of ladies in Cincinnati called the Triple Jeopardy Group.
Triple Jeopardy.
Triple Jeopardy is African American women with developmental disabilities. You have to be between the ages of 18 and 62. And that's anybody. You can be a grandmother, you can be a consumer, you can be a parent, you can be an auntie, you can be anybody, okay? And you come to those seminars and you get all kinds of information. Where to go get help, what help is available for you in the area that you live in. We do state resources, we do federal resources, and we do county resources. That's really good because we cover the gamut of services that are available to us right here in Ohio. And a lot of times people just don't know. So what happened with me is I met a lady in 2006, and I met her over the phone because I was trying to apply for a grant, which I had never applied for a competitive grant. And she said, well, since you haven't applied for a competitive grant, would you be willing to work with me and I'll just pay you? I said, okay. Money. So anyway, I said, yeah. She said, well, do you know 8 women in Hamilton County with developmental disabilities? I said, well, I don't know. Let me think about it. And I said, well, no, I don't. And she said, oh, that's too bad. And then I started thinking, everybody in my circle is either a consumer or a provider or a parent or a grandparent, everybody. So I put the word out that we were going to have this program and what it was called and what it was about and what we were going to be doing. And before you know it, I was only supposed to have 8 women. I had 32. And it has grown to 44. But they limit how many women we can serve because there's a money factor. You got to feed them. You got to provide transportation.
And money is always going to be a factor.
Right. So we do. This year we only did one. We did one in July 28th of this year. It turned out really nice. We had 34 participants and we had 4 speakers, and that was really good. We had 5 speakers actually. And we talked about housing, we talked about affordable housing, we talked about accessible housing, which is a real problem. And then we talked about caregivers. There's a caregiver shortage in Hamilton County. There's a national caregiver shortage. But the state places limits on how many hours you can spend with an individual a week.
Okay, and I guess that makes sense. And I hate it that we're running out of time, but if you could this is just a really short question. To work with your organization, does someone first have to be certified, I guess, through that that they have a learning disability or disabled through an agency, or can they still come to you, or do they need like a referral?
No, they can come to me. Disabilities don't have to be documented, they just have to be implied.
Okay, I love that.
Okay.
Marchelle, thank you so much. Definitely some information. You're one of my heroes just from what you're saying about working with your daughter, your children, and watching your face when you were talking about your daughter. You kept this big smile on your face. So I know that's love and not like, well, I just got to do this or anything. I could see the love, and when you talked about her, and especially her being bossy and stuff, you lit up. So I want to thank you for that. And we've got to have you back again, and definitely be in prayer for the work that you're doing and for your organization, that it becomes nationwide, that it begins to expand. So thank you again.
Thank you.
Listen, you've gotten some information. If you have a child, a loved one, a husband, a spouse that is dealing with a disability, you know to reach out. You know that there's help. And you can go beyond, I guess you could say, the normal. I don't want to say normal, that's wrong. But you can go beyond what is the status quo. We know there are organizations, we know that you can go to the state, you can go to the county. But there are also some other organizations that may not be county or state funded that you can go to. People who are living through and have lived through and living through what you're going through. So Anita, our producer, will put up information on how you can get in touch with Marchelle and her organization. Use the number, get help, and until the next time we talk, stay faithful, stay healthy.